What if I told you that one underlying problem is causing your child's sleep issues, their gut problems, their anxiety, their meltdowns, their communication challenges, their sensory overload, and their regression after illness? Well, upwards of 80% of autistic individuals are affected by mitochondrial dysfunction, which means there's a high chance that your child is one of them. In the next 10 minutes, I'm breaking down exactly what mitochondria do, why they're crucial to understand if you have a child with autism. I will give you the 5 signs that you may see in your child that may be related to mitochondria dysfunction and 3 ways you can support your child now. And at the end of the video, I'm going to tell you the best way to naturally support and build mitochondria, and it doesn't cost a thing. This could be the missing link that will help your child's behavior and build resilience. For those of you who are new here, hi, I'm Dr. Dana Johnson. I'm an OT with a PhD in mental health and development, and I help parents of complex autistic children understand what's really driving their child's challenges. Okay, so what do mitochondria do? Why are they important? Well, essentially, they are the powerhouses of our cells. That's what we were told in high school biology. They essentially take the energy from the food that we eat, and that's how our bodies move, and that's how we accomplish things during the day. That's how we think. Now, for individuals with autism, you can see that without this energy, things can be compromised, especially during development. During development, the brain requires so much energy, and if there is challenges or dysfunction with the mitochondria, then that's where brain development is compromised. And we see where that can lead to immune system dysfunction. We can see challenges with digestion, energy levels, or the body's ability to detoxify. All brain processes are affected. And so essentially every single thing that your child does, and as we do, requires sufficient mitochondrial functioning. And then when that doesn't happen, it trickles down into some of these symptoms that you might be seeing in your child, and you actually don't know where they're coming from. It's hard to find the root cause. Okay, let's talk about the 5 signs that you might see in your child that might indicate mitochondrial dysfunction. Number 1 is sleep issues. Mitochondrial dysfunction will disrupt the natural circadian rhythm, and specifically, it affects the hormone melatonin. And so throughout the day, all of us will slowly see a rise in our melatonin levels, which helps our body and preps it for sleep. And that's what we call our natural circadian rhythm. And if your child struggles to get to sleep or stay asleep, that could indicate mitochondrial dysfunction. Okay, number 2 is GI issues. Mitochondrial dysfunction is going to affect the motility and cause inflammation. Now, what does that mean? That means that once your child eats something, it is processed and goes through our gut. And without having healthy mitochondria, that makes moving through the gut much more challenging, which can result in constipation and then pain. So if your child struggles with GI issues, that may indicate mitochondrial dysfunction. Number 3, meltdowns. If your child has a lot of meltdowns, that could indicate additional inflammation in the brain, which then affects their ability to process sensory information, to regulate anxiety and stress levels and emotions. And when your brain doesn't have the energy it needs, it is going to affect all of the things that your child does throughout the day. Number 4 is, what is their diet? If it consists primarily of ultra-processed foods, then they are probably lacking the key nutrients that are needed to support the mitochondria. And so with mitochondrial dysfunction and then adding in ultra-processed foods, you're not supporting the mitochondrial health, and then it's actually making things worse. Number 5 is challenges with movement. Now, For movement and for us to be efficient with our movement, we need to have good, clear pathways between the brain and the body. And when mitochondria are unhealthy, that is going to affect their ability to help those messages get from the brain to the body. Also, energy. As I said at the very beginning, mitochondria help us to produce energy to move. And if you have mitochondrial dysfunction, then you're not going to be able to move. You're not going to be motivated. It's going to be very challenging. So lack of movement or getting very fatigued very quickly with movement could also indicate mitochondrial dysfunction. Okay, so let's talk about what we can do. Number one is sleep. And why sleep? Well, because it's important to recovery and learning, and not learning the way that we think as far as academic learning, although that's supported. We're thinking about what the body takes in all day, every day, the sensory experiences, the motor planning and motor learning experiences. Sleep is when our brain takes that information and solidifies it, makes it so that it will be permanent. And so without sleep, learning these new motor plans is going to be challenging. Now, with mitochondrial dysfunction, we just talked about how mitochondrial dysfunction is going to affect sleep because it affects the hormone melatonin. And so how do we then get everything so that we can get back into a good sleep cycle? Well, number one, consistent bedtime. Now I know you're probably like, we do that, but really try and go for the long haul. Be consistent every single night and commit to that. Number two, reduce screen time at least 2 hours before they go to bed. Now, I also know that this is like, yeah, right. Maybe it doesn't start with 2 hours. Maybe you start with 5 minutes, then 10 minutes, because the blue light from the screen, that affects mitochondrial health. And so that it also affects melatonin production. And so that is where it's going to be even more challenging if we get stuck where we're on these iPads or iPhones right before we go to bed. Okay, number two on what you can do is get rid of the ultra-processed foods. I know it's hard. I know that treats sometimes, which are fine, but if we think about the majority of the time, as I said in another video, 70% of our child's currently today, their diet consists of ultra-processed foods, 70%. So we need to start reducing that, because when we're eating all of those additives and dyes and seed oils and all of that, sugar is probably the worst thing for the mitochondria, then that is going to affect them even more. And the lack of nutrients, like I said earlier, that is not feeding the mitochondria. It's not helping them. By choosing whole foods, one ingredients foods, things that don't have a label with 25 million ingredients that you can't pronounce. Think about whole foods. Try that first, one at a time. Giving your child the experience, the consistency with that as well, will help their mitochondria heal. Number three, learn more about mitochondrial dysfunction specific to autism. When you dive into the research, when you dive into the information that's out there, you can learn so much specific to autism. Things like getting light, getting more red light. That doesn't mean that you need to buy a red light panel, although if you do have one or you want to buy one, that can be very, very beneficial. There's solid research on red light therapy and mitochondrial support. Just getting outside earlier in the day or in the evening, or getting outside into sunlight at any point is going to be helpful. But when you dive into the research, and I will link multiple articles specifically related to mitochondrial dysfunction and autism so that you can learn more and be that informed parent so that you can then support your child and their mitochondrial health. Okay, so what is, in my opinion, the number one way to support mitochondria? Well, that is exercise. And I've done a number of videos on exercise and the benefits and which exercise specifically that I recommend, so you can check those out. But specific to mitochondrial health, why exercise? Well, exercise is the only way that we can build new mitochondria, and that's called mitochondrial biogenesis. So the other ways that we I just spoke about, those are all helpful, but this is, in my opinion, the best way. Now, what is the bonus to exercise? Well, it also supports building intentional movement and gives sensory input. So if your child struggles with whole body apraxia and regulation, exercise is a great way, specific resistance training, to help give that input that they need to help regulate. Number two, it also helps support sleep and getting into a regular sleep cycle by stimulating those hormones that are involved in natural sleep cycles. I already know that sleep is so difficult for so many of my clients, but exercise can really be beneficial, and I cannot talk about it enough specific to my clients and individuals with autism. Now, just remember to support their body through motor coaching, because movement can be a challenge for sure, but once you start, it only gets easier. Now, if you spent years trying to figure out why your child can't sleep, why the meltdowns keep coming, why their stomach is always a mess, and no one has been able to give you a real solid answer, well, I hope today's video gave you a new place to look. Mitochondrial dysfunction isn't something most physicians are talking about, but the research is solid and it's there. And what's happening at a cellular level in your child's body could be connected to much of what you're witnessing every single day. Now, the good news is that you can do something about it. Now, small, consistent changes to sleep or diet and movement can actually start to shift things. And then from there, finding a specialist who understands mitochondrial dysfunction in autism can be the key to your child's progress. This is definitely accessible, and it starts with you. Now, I know how exhausting it is to feel like you're doing everything right and still not seeing progress. That's exactly why I keep making these videos, because your child deserves answers, and actually so do you as their parent. If this opened new questions for you, excellent. Ask them in the comments. That means that we have way more to talk about. Subscribe and come back next week, because I will make sure that as a parent, you are informed on the things that are important to your child's health and development. And drop a comment below and tell me, which of these 5 signs are you seeing in your child? Now, I read every single one. Thank you, and I will see you on the next video.